Courageous Doctors is a newscast about healthcare topics of concern to everyone. From health and safety tips to recall notices and medical news. Here's your host, Dr. Barry Prystowsky.
Hello and welcome to Courageous Doctors, the news show for you and your doctor. On this show, we'll first start with some COVID updates, and then we'll get to our usual news show with Obamacare updates, other healthcare news, and health and safety tips. So let's begin. First with COVID. Okay, the Star Ledger was reminding us that now we're seeing more young adults getting infected, up to as much as a third of our new cases. And of course, they're making more of the cases in the hospitals now. And, the death rate in New Jersey is close to 16,000. Of course, we're a lot less than we were in March, April, and May, and we're better than the other states that are really bad. But our infectivity rate is greater than 1, meaning we want to keep it under 1. It's almost 1.5, which means one person is infecting exponentially more people, so that's no good. So we have to be careful that we don't get into trouble like we were before and like Miami and California, Texas, and some of the other states are. Some of the really big problems is we're worried about how to open up schools and whether you have to test or not. Most schools I know in my area are doing hybrid, where they're going back maybe 2 days a week and the rest online. But each school district is different, and all bets are off in terms of whether we're going to be testing in schools or not, and whether we'll get those test results back soon enough to mean anything. We'd like people to be careful in the classroom and wear masks, but I don't believe that's going to be mandatory. But it would be a good idea to follow all the safety rules, wearing masks, safe distances, constantly, using a sanitizer, something safe to wash your hands, avoiding touching other people's things, and wearing gloves when you go to the bathroom. Careful with safe distancing on school buses if you can't walk to school or be driven. But we're going to have to see what happens. School's going to be opening soon, but we still have a lot of summer to get through, so we'll see what happens. Star Ledger went on to also mention that unfortunately, although children are infected at a lower rate in terms of becoming ill, we know they carry the virus, but they don't get as deathly ill as we older adults do. However, there have been deaths in children, and we've all seen those on the news, and it's still scary, especially now with them going back to school. Some studies were suggesting that children under 10 were less likely than those over 10, but these are we still need to study. This is a relatively new epidemic. We're less than a year into it, a little more than half a year, and we're learning so much. Let's see, Fox News, again, said that almost half, 40% of the cases are asymptomatic, but they're still very infectious. And a recent study out of, I think, Korea showed that even asymptomatic people have just as much viral particles in their nose and can infect it as well, even if they don't show symptoms. Again, a reason for safe distancing and wearing masks. Newsweek gave a very disturbing report from the European Heart Journal that half the cases, had developed heart disease, and we have a very scary virus that attacks blood vessels, causes a vasculitis. That's why it clogs up lung clots, heart clots, strokes, kidneys. That's why people are on dialysis, getting lung transplants, having heart disease. And we're not really sure. Some studies suggest it may not be just the classic coronary heart in the coronary vessels. It might be more in the muscle, myocarditis, but whatever it is, it's not good. CNN reminds us that the 3 most common symptoms, of course, are fever, cough, and shortness of breath. But they also remind us we're seeing a lot of diarrhea. And this is kind of scary for me as a pediatrician in the office. It's summertime, and we get a lot of diarrhea with Coxsackie virus and summer flus and people exposed in pools and things. And so I never know for sure I mean, I'd like to just think if somebody didn't have fever or shortness of breath or pneumonia or coughing that I was safe, but it might be the diarrhea case walking in or somebody asymptomatic. So we can't let our guard down. Of course, you can feel like the flu, lose your sense of taste and smell. And this is interesting. You can get petechiae, which are, remember how if you cough or vomit too hard, you get those little like blood patches, little red dots on your face that don't blanch when you touch them. You can get that in the mouth. And that's disturbing also for me as a physician, because we normally think of petechiae in the soft palate in the throat as being caused by strep, but now it might have been COVID. Young adults are taking just as long to recover sometimes as even from mild infections as the older adults, and those that were in the hospital in the ICU or on ventilators that had damaged their body organs are going to take a year or more if they ever fully recover. And of course, we're hearing about the effects on not being able to think straight, losing your balance. I mean, this is just a horrible illness. Let's see. Let's move on to treatments. Science magazine has a number of comments. One's from antiviral research. They're saying that heparin's is the clot breaker, so you don't clot. Remember, we said this virus gets in the blood vessels, and the body's response to try to stop it is to clog up the vessels, and you have a huge inflammation response. Heparin, which you use to prevent blood clots, which we're also using to treat these very sick patients, actually has a side benefit of actually blocking the virus itself. And that was interesting. I didn't know that. University of Michigan research published in the Clinics of Infectious Disease Journal commented on the anti-interleukin-6 drug, tocilizumab. We know this is a main cause of the inflammatory response in the virus that damages the organs. And of course, you don't want to stop the immune inflammatory response to protect you from the virus before you get to the hospital. But once you're in there and you're fighting for your life, and it's a matter of your own body response is killing you even more than the virus, then you want to stop this interleukin-6, which is our body's protection to try to kill the virus. But so this drug did kept the death rate to less than 45%, so it had some effect. But of course, you're going to still get pneumonia because you're suppressing your immune response. Let's see. Fox mentioned that a Gilead company, that gave us remdesivir. That's the IV medicine that we're giving. That's we're using. That's actually killing the virus inside the person. That may be available as an inhaled product. They've been researching that, and that would be great. I can use it in the office. And Science Magazine just reminded us that we're also using Decadron, which is a kind of steroid, because that generally steroids reduce inflammation. But again, you want to be careful, like Dr. Fauci from the NIH said. You don't want to be, patients call me up, can I have Decadron? Dr. Fauci said you don't want to decrease inflammation in somebody that's not sick enough for the hospital, because you need the body inflammatory response to kill the virus. So you're always weighing against, I need my body's response to kill the virus, but I don't need an over response that's going to damage my organs. And that's always a tough decision. And Science Magazine lastly stated that 7 drugs that are commonly used for cancer treatment are also helping to decrease the body's inflammation. Let's see some other facts, other interesting facts. Science Magazine, this is interesting. I've read this before, that out of Rutgers University here in Jersey is showing that the asthmatics were not at a higher risk. We initially thought, coming out of China, that this virus, that the asthmatics were in danger as in addition to anybody with body organ damage or diabetes or anything or chronic illness, but they're suggesting that maybe the asthmatics are not at increased risk. And they were commenting also on the fact of why the kids seem to get less sick, although we know some kids do die and get sick. Kids, as a general rule, have less receptors in their lungs that bind this virus, and they have more T cells. Now, remember, you have an antibody, which is what you build up with vaccines, and like we want to build up our antibody titers and things, and we're trying to vaccinate to do that. They bind the virus and hold on to it till the body can kill it, but it's the T cells that are actually the things that cause cells holding these viruses to destroy the virus, and they destroy the cell, but destroy the virus, killing the virus, that the kids may have actually less places for the virus to hook onto in the lung vessels, but actually more T cells, so you get less of an inflammatory response, and they kill the virus before it even starts. And they also have more interleukin-10, which quiets down the interleukin-6, so the kids get less of the inflammatory response. But again, we've reported in the past about the Kawasaki's vasculitis-like condition where kids get as sick as adults, so some do, but as a general rule, I found that very interesting why they don't get as sick. We know New York Times reminded us that CDC said that it may not be necessary to constantly retest after you've had the illness. If you've gone 10 days and you haven't had fever off of Advil or Tylenol antipyretics for a day or two, and you're not showing symptoms, shortness of breath, diarrhea, that may be good enough just to go back to work. USA Today was mentioning that the FDA has released the ban on home testing. It's been approved so that maybe we'll be able to do our testing from home and mail it in. Might get faster test results. And lastly, on COVID, I found it very interesting, the Washington Post article that was reviewing what some of the health experts like Fauci was saying. I'll just mention Fauci's tips, was reprinted in the Star Ledger, and I found this very useful. So Fauci himself, Dr. Fauci, wears a mask even in the office unless he's alone or he's with his family, keeps distancing. He made a few, I found these very helpful comments. He said he does not disinfect his grocery bags when they come in from shopping, like they're home delivered. He just, he'll wash his hands after touching them. He leaves the items out for a day or two before putting them away unless they're perishable. Same thing with mail. He doesn't disinfect the mail. He just lets it sit for a day or two before touching it. If he has people over his house, they're few in number. They eat outside. They have their own separate, their meals or takeouts in separate bags. He wears a mask when he gets the haircut. If his kids visit them, he quarantines them for 14 days. And he commented on schools, and he's said this many times, even on TV since this article. It depends on where you are. For example, if you have a high infectivity rate, like Miami, I don't know how they're going to open schools. In Jersey, we're pretty low, so we'll probably open at least a couple days a week. But in terms of how to keep the school safe, we've already talked about that, but that was his comment. So I found that interesting.
Don't go away, there's more courageous doctors after these messages.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Courageous Doctors continues with Dr. Barry Prystowsky.
Okay, very good. Let's move on to our usual news show. We'll a few pointers on Obamacare. Let's see. Washington Post said that again we're struggling to find enough protective gear, whether it's masks or gowns, face shields, gloves. And I got to tell you, I'm finding the same problem. You know, ever since March, my usual supplier for years, I just can't get things from them. Fortunately, my professional society put me in touch with, some people that were able to get me some shields and shields and masks. Yeah, but I'm still trying to find gloves, and I was able to purchase some gowns too. But yeah, I don't know where all these. I know the president says that we have billions or millions or whatever, but I don't know whoever has them. But we're having trouble as small doctors, and I guess hospitals getting them. Okay, so let's see the Supreme Court. This is I'm changing subjects a little bit, but the Supreme Court on contraceptives. Remember with Obamacare, he originally, when it was put into place almost 10 years ago, he said that he would allow religious institutions who insure their employees, if they're against abortions, to not make them pay for it. But now other people were testing that out. Like I actually heard the Supreme Court arguments on C-SPAN, and it was, is a corporation considered an individual? And attorney generals were filing all kind of lawsuits about this. And so the Supreme Court finally said yes, it doesn't have to just be a religious institution. Any corporation that's treated like an individual, if they feel they don't want their insurance for their employees to pay for, the abortions or contraceptives or what have you, that they're allowed, that they don't have to. Let's see, Newsweek was commenting that, this is back to COVID, but they were commenting that you remember Wuhan, China, where this all broke out, they were actually for many years studying this virus because workers in their mines who came into contact with bats were having severe pneumonia back as far as 2012. So apparently this is a virus they've been studying. Jumping around, I'm sorry, but Washington Post, back to the courts, said that, remember the president said you can have very cheap insurance plans that don't have to cover everything that Obamacare does. And there was how long can these plans last? And the appeals court, one of the district courts, said that yes, you can still use these short plans, even though they don't give you all the protection and benefits of Obamacare. Politico, I actually heard the president when he announced this at the White House. The president had signed an executive order recently trying to cut down drug costs. He's been working on this for a while, and there were 4 parts to this: importing cheaper drugs, decreasing the price of insulin and EpiPen, having the United States as a favored nation rule, where we can actually not only make our drugs here in this country, but allow Medicare to buy cheaper drugs overseas, and curtail the rebates on benefit managers. I don't know how many of these 4 he's been successful with, but he's doing what he can to lower the price of drugs. Okay, let's move on to other healthcare news very briefly. I always like to start with recalls. So again, check your supermarkets for any of these. They may or may not still be current. But Cyclospora, which is a very painful parasite, you can get it in swimming pools and contaminated water. Here, it's in bagged salad. and in this case, it's made by Fresh Express, and it can be found in ShopRite, Walmart. So just check and see that your bag salad hasn't been recalled. Let's see, Salmonella was found, USA Today said Salmonella was found in red onions, and the company is Thomas International. And just today, there was a report out of Fox that Taylor Farms are recalling their onion products, I think, just to be sure. So be careful, check to see if your onions are being recalled because of Salmonella. Whole Foods, this was not infected, it's just their spinach artichoke dip. Forgot to say it listed eggs for those with egg allergies, so be careful there. And let's see. Okay, and then that's recalls. And the BBC said that there's a new China flu virus from pigs, and 10% of the pig workers are getting infected, and it has not been put in the vaccine, so we may have another really bad flu if the Chinese pig virus, swine virus, comes out to us. Hopefully it won't, but we have to watch that. USA Today reminds us that it's summertime, so be careful with tick diseases. They get flu-like illnesses. You know what the tick diseases are. They're Lyme, babesiosis, the Powassan, Rocky Mountain spotted fever, anaplasmosis, ehrlichiosis. All these Lyme disease-like things, they cause flu-like symptoms, and they can make you pretty sick. And they can look just like COVID or any other flu. So, take precautions. You know what to do. Put on the DEET, put them on your clothes. Interestingly, they say if you're using suntan lotion, put that on before you put on your permethrin or your DEET. Put it on, but spray your skin, your clothes, and, inside, be careful, don't let the ticks or mosquitoes in. You know what to do. If you have places that have water pooled up, dry up the water. I always go around my backyard, anything that contains water, trash lids, anything that collects water, I try to dry it up. So let's see, the New Jersey Department of Health said also be careful with the mosquitoes. Although most of them are harmless, we're all worried about things that can cause brain encephalitis, and you get really debilitated. Just like this COVID, you take a year to recover for some of these things. Fortunately, most people don't get that sick, but you're worried about West Nile virus, Eastern equine encephalitis. Remember last year in New England, they were afraid to go out at night. I have family in Rhode Island, and they were told not to go out at night. And other viruses like that, so you have to really be careful. Let's see, Science Magazine said that, this is interesting, just an interesting point, just to change the subject for a second, that they found how cancer cells talk to cells around them to turn them into cancer cells, and that was interesting, something called the RAB11A exosome, secreted by the cancer cell that tells the neighboring cells to become cancerous. So you're always looking for new cures for cancer. Okay, let's move on lastly to health and safety tips. Here, please refer to your screen. We've listed over 100 products, hand sanitizers that are poisonous. This has been going on for a couple months now. We found, remember, that it's just like soap and water kills and the hand sanitizers are supposed to have alcohol. That alcohol is ethanol, not methanol. Ethanol, ETH, not METH, methanol. Methanol, it can kill you. It's poisonous. It absorbs through your skin, seizures, coma. It can damage your kidney. These sanitizers can kill you if you're using them, and they're huge recall. Most of them coming out of Mexico, I think, like Mexico iTech 361. All Clean Hand Sanitizer, another one, Grupo Insomo Soluciones, something like that. But just look at the list and don't buy them. That's very scary. Let's see. Let's end with a few fun things. FoodNet, I love that site. FoodNet is reassuring us interesting. My son just asked me this question: can he feed his baby from canned tuna? And in FoodNet, it said yes, canned tuna is safe. Canned salmon is safe. I eat a lot of canned salmon. The cans do not contain that chemical BPA. Remember the one we always worry about, like the polyfluoroalkylons, alkylated products, all that stuff, like in plastics and the stuff polluting our water and all. Same stuff that makes acrylic, polyesters, firefighting things and all, stick-free pans and all. Anyway, the cans for tuna and salmon, FoodNet says is safe. They're not made with that. Let me just end on some really fun tips. FoodNet says, here's some things for quick lunches for kids. I love to read stuff like this. Let's see, toaster oven veggie pizza, macaroni and cheese, bacon, egg, and cheese, quick things to make. Corn and mushroom with ramen noodle bowls, turkey hummus wraps, zucchini salads with cheese and nuts and pasta, and of course anything with peanut butter. And they remind us that peanut butter, which I eat a lot of every day, has 2 tablespoons, only has 191 calories, has only good fats, very high 7 grams of protein, 2 grams of fiber with vitamins and magnesium. But it says to be careful if you get a low-fat peanut butter, it may have added sugar. And very lastly, just to mention, they've come up, the government has new guidelines on feeding babies, which of course I'm interested in as a pediatrician, reminding us that breastfeeding moms really need to give their babies vitamin D and iron, and that they're instituting feeding babies earlier, eggs and peanuts, as early as 4 to 6 months. So that wraps us up. It was a fast news show, but hopefully that keeps you up to date. As always, it's a pleasure talking to you. I try to do this as often as I can. We welcome your comments, and I look forward to talking to you shortly in the future. And be safe, be well, and stay cool.
Courageous Doctors, Pioneers and Heroes. Executive producers Barry S. Prystowsky, MD. And Patrick M. Marucki. Post-production Patrick M. Marucki, makeup by Lisa McAllister, salon Jimmy Gerards. Music provided by Video Blocks. Special thanks to American Medical Association and New England Journal of Medicine. Visit us on the internet at courageousdoctors.com.